and now we'll go finish the popliteal with the last talk from Dr. Jacques Busquet, who is going to be talking about popliteal aneurysm, the best therapeutic approach. So I can see Dr. Busquet, he's in his typical beautiful French attire now.
So what's the best treatment for complex popliteal aneurysm? This is a question. The prevalence of popliteal aneurysm is 1% in the general population, affecting more men than women, and predominantly arteriosclerotic. The elective treatment is between 2 and 3 centimeters in diameter, symptomatic or asymptomatic, because popliteal aneurysm used to bring complication, acute limb ischemia, rupture, compression, and there is a risk of amputation. Yes, the amputation rate is high, between 10 and 40%, especially in patients with severe ischemia. It's only 1% in elective repair, thanks God. Look to this bad image. This is a thrombosis of a popliteal aneurysm leading to an amputation transfemoral. So what the best management? This is a question that I have to solve in 7 minutes. You know that the standard is saphenous grave bypass graft. It's easy to get if you got a vein available. So this is a question of choose of best technique of treatment. Prevalence 1% of general population. Elective treatment, diameter between 2 and 3 centimeters, symptomatic or asymptomatic. Because of complication, acute limb ischemia, rupture, local compression, leading to risk of amputation. Amputation rate between 16 and 43% in patients with severe ischemia, only 1% in elective repair. Look to this, thrombosis of popliteal aneurysm leading by mischance or to amputation, transfemoral. What's the best management? You know that saphenous vein graft is the standard. You have to collect a vein if available, and then you do the bypass, allow the knee flexion on a dynamic angiographic control, which is good. Now we have some cover stent. This one is devoted to this kind of indication. It's useful in this particular indication. Dr. Moll, Franz Moll, did a review of nearly 50 studies, and there is quite the same 1-year patency rate, open or endovascular. And it's quite good 5-year patency, 85% with vein graft. Let us see this funny case, funny in a way. The initial diagnosis was a deep vein thrombosis. In fact, it was a giant aneurysm with curvature, with a second aneurysm, and a compression of the distal vein, 65 centimeters. And on 8 millimeter, on 80 millimeter length. So because of distortion and angulation, we went to surgery, decision of open repair, because all this reason. So we exposed posteriorly this aneurysm. It's quite huge. We open and we collect this debris inside. It was the reason of the compression of the vein and the false diagnostic of deep vein thrombosis. We did a bypass graft because no vein were available in a hand-to-hand anastomosis, and with a good postoperative reserve attested on MRI. In conclusion, ladies and gentlemen, sorry for the delay at the beginning. you have to evaluate the patient status before all. The decision of operation should be endovascular, open, or hybrid, and don't hesitate to do a surgical conversion when necessary. A follow-up is also important to assume the best treatment for this kind of patient. Thank you for your attention.
Thank you, Dr. Busquet.